Today, we are pleased to launch the first colloquy of our 2021 season. We have Reentering, Reemerging, and Reengaging the Ethics of Self-Care. And I'm really excited to have our speakers here. We have Portia Turco, who is, I'm trying to read off all of your titles. It's too small for me, my eyes are not that good. But she is in charge of 2 counseling programs on campus. We have Christy Minck from our counseling center here. And we have Liz Onasch, who is from our Department of Sociology and has kind of a sociological perspective on this topic. I'm really pleased to have them here. There's a wealth of resources, and not just up at this table, but in this room here. So I would like to get us started. I guess my first question for everyone is, I wonder if you could tell us a little bit about the state of mental health today, and just
we see about 10% of the college student body in any given academic year. And that has been traditional across the period of time. It has actually grown across the 17 years that I've been on campus. Interestingly enough, during the period of time when we were in the midst of the critical emergency of the pandemic, the demand for our services decreased. And that may sound a little counterintuitive. Any thoughts from anybody in the audience as to why you think we might have been seeing fewer people during the pandemic? Anybody? Ideas, thoughts? Yes.
Does it have anything to do with our students taking courses online, so they're not on campus?
Yes.
Or they don't get service?
Yes, that I think is definitely a part of it. So we had to transition from an in-person model of care on a dime, I will say, by the way, as many of you all did too. Remember that period of time in March of 2020, right? 2020. From an in-person model of care to a telecounseling model of care, and that did impact our services in terms of some students maybe being more reluctant to engage in Zoom therapy, right? Okay. And I think, I don't have data to back this up, but I think the other impact that we saw is that when we're in the midst of crisis, we have to really put our efforts to basic kinds of needs, right? Okay, what's most important? And I think for some people, the concept of I'm going to take care of my mental health right now kind of had to take a back burner. Because here's what we're seeing now in the last week and a half. Are we at a week and a half right now? Okay, week and a half is that we're now beginning to see that demand go back right where it was in pre-emergency pandemic times. The other thing that I would say that we see here on campus is that we see a fair number of students with suicidal ideation. People ask me this question a lot. About a quarter of students that we see do report thoughts of suicide in any given semester. Compare that to, however, the number of students who have planning and intention. That number is much, much, much smaller. So it's not common for us to have students who have planning, intention, they really want to die, but thoughts of suicide are quite common among our student body. So that's what we're seeing here on campus.
Yeah. And I would like to echo what Christy said. So for me, I'm in the training end of the campus. So I'm the director of the Waterfall Counseling Clinic. So the clinic predominantly serves our graduate students in their training to become licensed mental health counselors. So they see a lot of our students on campus as part of their clinical training. And I think for us, really what happened last year is we saw the intersection of all of those inequities, right? So demand for services in person decreased because a lot of our students, of course, went home. But the intersection of poverty, of some of those socioeconomics, of needing care but not being able to access care started to show up even more. We do live in a rural community, so of course this has been a challenge. Besides campus, we also have our community settings where we know that the disparities have continued. So I would say they multiplied during COVID, during the pandemic in general. So transportation, food, and access to even internet. So a lot of families, even when we did provide telehealth via Zoom or other platforms, they're not able to connect to those broadbands to be able to access the service. And also the telephone calls. So you can't call if you can't get phone service because you live somewhere in the mountains. So I think really for me what I would say in terms of the disparities, I saw a lot of those show up, which I believe magnified the anxiety. So I'd say, some of the suicidal ideation, when you look at suicidal ideation from a clinical standpoint, you can separate it from people who want to really die and people who feel like this is the only way out, right? So a lot of that started to show up. Food insecurity started to show up and become highlighted even more. And I would say that I saw a lot of maybe young adults and adolescents struggle the most, in my opinion. And that's because of the grief that's associated with the pandemic. So we saw a lot of loss, a lot of maybe students who didn't end up getting graduation, the traditional form of graduation. They didn't get prom, the traditional prom. They didn't get to see friends. They didn't get to do a lot of the maybe things that we associate with being a young adult or adolescent. So the depression symptoms went up, anxiety symptoms went up. We saw a lot of trauma. So when we understand that a lot of our families live under stress, generational stress, we see a lot of that, the violence start to go up to interpersonal violence, intimate partner violence. So the disparities from COVID, I think that really multiplied and pronounced some of the challenges that we already have. So from our community standpoint, besides the clinic, we've never been able to meet demand for services for mental health. And I'll tell you that for us as a training clinic, in the last 5 years, every single one of our students was hired in internship, and we still haven't been able to meet demand. So if that gives you an idea of what it looks like, the state of mental health in our Clinton, Essex, Franklin counties, and that's just a small microcosm, right? We haven't translated that throughout the state. So I think that's what I'm seeing. And continuously, people are saying, we want to get help, but there's nowhere to go. So that's part of the challenges for our end in terms of training and providing services.
So from a sociological perspective, more broad-based, what are you seeing in terms of mental health?
I'm not as qualified to speak about mental health, but I do think that many of the forms of inequality that have already been present have been exacerbated through the pandemic, and the ways that inequalities shape health disparities are also being exacerbated, right? Both in terms of contracting the COVID virus or COVID-19, getting health care, but also in terms of affecting people's mental health and then their access to being treated for mental health.
So I think we started to see some trends more globally, like in the U.S., with even before the pandemic, like the pandemic exacerbated things. But we already were having issues as a society with mental health. I didn't know if anyone wanted to speak to that or just acknowledge that rates of suicide, rates of depression, anxiety were going through the roof, drug addiction.
Yes, I can talk to that a little bit. I think that it's important to remember that all of these things that we talk about happen at the intersection of all of other things too. So when we look at mental health, we have to understand, especially if we look at our community, that we're looking at generational things, right? Generational poverty, generational trauma. We're looking at historical things too that impact mental health. So the baseline maybe started at a point where people were not as strengthened, and maybe not as resourced as they could be. Homelessness, housing is a challenge. So when you have housing, this is what Christy was saying earlier. When you look at that basic hierarchy of needs, we want to look at shelter, food, safety. So when people are starting at a point where there's a little bit of a deficit, and then you add that to compound it, it becomes even, and then you look at the disparities in being able to access healthcare, having insurance, so it becomes multiplied, right? So, and that's where we are as a community. Those are some of the things that need attention, and that a lot of us are advocating for.
Nationally, I think to speak to some of what Michelle was talking about, we in mental health do say that 1 in 4 individuals will be diagnosed with a mental illness at some point in their lifetime. So we know that there are tremendous numbers of individuals who will be directly impacted by mental health. And then when we start to talk about people who will have secondary effects related to mental health, loved ones, family members, we're talking about a tremendous number of people in our country who will somehow be impacted by mental illness or mental health conditions. I want to piggyback on something that Portia was talking about a little bit earlier when she talked about the rates of increase in anxiety disorders and depression disorders as a result of the pandemic. The CDC does have research which says that those rates among college-aged individuals increased by 60% during the time of the pandemic. So that's a tremendous increase when we're starting to talk about the numbers of individuals who have been affected and the impact, and then when we start to talk about access for services in a system that is already broken. I will say that mental health services are broken in our country. And yes, there are some attempts being made to address that in terms of monies being given for mental health services, but it's almost like I don't want to say too little too late, but I did just say that out loud. It's almost like we're throwing money at a system that is in such deep need that it's kind of like we needed this all along. But we have such stigma around mental health as well, and that's a component of this too that we haven't really talked about.
Right, absolutely, Christy. I think 2 things for me, based on what Christy's saying. The first is that I think it's important to understand from a biological level. So we look at the biopsychosocial aspect of mental health. And when we look at anxiety, it's important for us as a campus community to understand that when somebody's in a state of anxiety, the capacity to learn is diminished, right? So when you look at the biochemistry of what's happening when somebody's anxious and all of the neurochemicals that are associated with the state of being anxious, we know, and just to summarize, the most impactful thing with anxiety is that it triggers a state of survival. So you're in survival mode. When you are in survival mode, your brain is saying that there's a tiger coming, right? So if you understand the extreme nature of that, you're going to think about learning. So the capacity to learn, to retain information, to store information for easy retrieval doesn't happen. So if we're expecting somebody whose brain is saying there's a tiger coming to learn, to retain that information, to process, to interact, we're really demanding a lot from that brain, right? So I think this is why it's so concerning to hear a statistic like 60% from the CDC. So part of what happens then is we need to think about our campus culture and how we support people who we need to anticipate that a lot of us during this pandemic are affected, right? So for us as providers of mental health services, we are affected at the same time. So we're all united in this. So some people are affected more than other people, but all of us are in this. So we as maybe educators, as counselors, as students, we're all supposed to function, but really we've been impacted. So this is that I think maybe that's that dilemma. Like how do we manage, how do we get the day-to-day while we're being impacted? And when the brain is saying we really don't want to learn, we want to run away, we want to hide, we want to freeze, so I think that's important when we look at that as a campus community. What do we do to intervene to reduce that level of stress and anxiety?
So that brings us to the topic for today, right? And it being the ethics of self-care. I wonder if you could discuss some of the ethical implications. I mean, we are always told to take care of our fellow human beings. But why is self-care an important thing? And what is, just explore some of those ideas with us if you would.
Well, I think first of all, we have to define self-care. So what exactly is self-care? Would anybody like to tackle that as a definition?
Well, I'll give it a try. So
Okay.
I feel self-care is a new idea to me. Something I always pushed off, like, nah, that's, getting my nails done, my hair done, I don't have time for that, I don't have time for that, whatever, self-care. But what I've come to really realize is kind of digging deeper into myself and understanding the things that I need to, be content and be productive within my life. So whether it's eating healthy or going for a walk or, just sitting by myself in silence, which is really one of my favorite things to do, to just decompress. So to me, I think self-care, again, just to say it concisely, is this understanding of what is needed individually to feel happy and productive in your life.
I love that. Okay, so you're really speaking to self-care is not something that is like this universal concept that we can all like, okay, give me a pattern that everybody can do for themselves. It really is an individual's plan for taking care of their mind, their body, and their soul. So there's components that are really, all encompassing for each person. And that's kind of how I would define self-care. I don't know if either of you would think about that differently.
I would just like to add that it's interesting that your definition of self-care really connects with Michel Foucault's definition or his discussion of that. He's a French philosopher, and he talked about the care of the self as something that was important to ancient ethics, and it was something that was practiced by philosophers like Socrates. And he argued that it involved kind of knowing oneself, like self-care. Part of self-care was knowing oneself through reflection and examination of the ways that you think, your own discourses and ways of understanding the world. So it's interesting that knowing yourself links back to this old definition as well.
Absolutely, and I think, your definition ties to what we call the 8 dimensions of wellness, according to SAMHSA. So a lot of us mental health counselors and providers, when we look at wellness, we look at 8 different areas. We look at spirituality, right? Spirituality, we look at social connection. So what we know is that the brain actually craves connection to other people. So when you think about the pandemic and think about how a lot of us were isolated in a lot of ways, then you start to see how that impacts wellness. You're looking at financial well-being. Right? Financial well-being is another area. And you think about maybe job loss. Think about what's happened in terms of income for different families, different people. You look at emotional well-being, environmental well-being. So just being in a pandemic is an environmental stressor in a lot of ways, right? Think about people who, for us in the Adirondacks, we've been perhaps more fortunate in being able to socially distance in a healthier way. I know a lot of people have been hiking in the summer. They felt like they needed to be out so they could be in nature and be socially distant. But we did see that a lot of people in the cities couldn't do that, right? So being confined in small spaces, not being able to get out. So that impacts that well-being. And then intellectually, being able to learn things, being able to try new things. So how has that been impacted? And then physical. So physical well-being, health disparities highlight some of that, and especially in communities of color. So we saw that definitely COVID really showed some of the disparities that a lot of us knew were present, but it magnified them, right? And then occupational well-being. So do you like your job? Do you like what you do? Do you find meaning? Is this fulfilling? So all of those different areas, the 8 areas, go on to contribute to what we know as well-being. And being able to really assess for yourself, going back to knowing yourself, and finding out what are the areas that feel like they're lacking for me, You know, what's missing? So when you look at that wellness model, you need to be able to at least identify parts that are working well and parts that are not. And you know, when you look at them, they can be simple. They don't need to be complicated. In terms of physical wellness, you could be asking yourself a question like, do I go to my doctor's appointments? Do I make them? Do I actually keep them? Do I go to the dentist? Do I brush my teeth? So some of these have levels. They don't need to all be big and maybe like unmanageable. So I think that this is a helpful way to, I think, operationalize wellness, if you want to think about it like that.
As licensed mental health counselors, I think of the ethics of self-care in two different dimensions. So as Portia was talking about it, we as mental health counselors really explore these dimensions with our clients. We engage in self-introspection with our clients, and that is part of our job, is to really look at these areas. How are our students, clients, optimizing their mental health and well-being? So that is a core of what I do as a mental health therapist. It is my ethical obligation to do this work with the clients that I see. But I also have an ethical obligation to engage in what is called competent care. So as a therapist, I must make sure that I am also engaging in self-care for myself to ensure that I'm not burning out and that I'm able to do my job to the best of my ability. So I have both of those dual types of obligations ethically to practice my profession.
Yeah, absolutely, Christy. And I would say that to be able to be effective in what we do, we have to be well. And so that might extend to being a student. It might extend to being an educator. It might extend to, so can you really do your job effectively, competently, if you are in some way impacted, right? So if you are not fully sleeping, if you're not eating well, if you're not taking walks, can you focus and do the work that you need to do? But for us, it becomes an ethical mandate, so we are required, that's part of our licensing. But I'm thinking in terms of people who are not required by a license, you could extend it to family members. Are you an effective partner to somebody if you're not doing well? Can you be an effective friend? Can you be effective in your schoolwork? So I think that the ethics of that really talk to being the best version of yourself as much as possible.
Which brings us back to that question of, is taking care of oneself an ethical responsibility? And I think the answer is yes. It is.
So I'd like to point out a kind of potential pitfall or problem that can arise with self-care. And I think this is more the case when it's being defined in popular culture, kind of outside of a clinical or professional definition, right? So as you're saying, doing your hair, doing your nails, right? So this idea of self-care has been commercialized, and so you buy things for your self-care. You buy face masks, you buy a day at the spa, etc. You can look on Instagram, hashtag self-care, all this stuff, and it number one promotes consumption as a method of like soothing yourself. And number two, it turns our attention to ourselves and to individual sources of stress or anxiety or trauma, as opposed to looking at the social level, right? So that we're concentrating on self-care and not necessarily thinking about why are we not getting adequate care from our medical system, right? Or why are we, you think of these things as individual problems. I'm stressed out, I'm taking care of myself, but we're stressed because we live within, a racist, sexist, capitalist, system, right? And so sometimes the emphasis on self and individual can kind of obscure those broader connections. And again, that doesn't have to be the case, but I think that in a kind of popularized consumption model of self-care, that can happen.
Yeah, Absolutely, and that's a great point. I think it also goes back to that idea of connection too to other people. That advocacy can be a form of connection.
Yeah.
So, and advocacy can be in any way that feels like it's congruent with how you are, with who you are. So connecting with other people at a biological level is very healing, right? So we know that even when we're working with people who are significantly mentally ill, just the act of going to help somebody else clinically has shown results. So we see a lot of improvement. So without doing anything else, just feeling like you are of value to go help somebody else has that restorative healing property, which is really interesting, right? Yeah.
So when you look at research-based or evidence-based practices of self-care, as Portia says, that is one of those. Paying it forward to other people is another research evidence-based self-care practice. But I think that, what Liz is talking about is really, really important in terms of looking at a larger perspective and social justice and what would be the role of social justice in our lives in terms of being able to really advocate as a self-care practice. Yeah.
Yes. And I think that's a key point too, because I'm looking at our 8 dimensions of wellness and I'm thinking about our marginalized communities, right? I'm thinking about, if I'm looking at occupational wellness, what are we thinking about in terms of minimum wage rates?
Yeah.
So is it really possible to find financial freedom? How do you do that? So some of these pieces of it really require all of us to come together on that when we look at social justice, right? Being able to take a day off has huge implications for families who are financially insecure, right? Or food insecure. So some of those definitely tie into a much level, that systemic structural level of our societies.
So you might kind of liken it to if you're ill and you take aspirin or some pain reliever to dull the pain, but you don't go and treat whatever it is that's actually causing it. It's kind of the same thing with our systems in society. Some of this pain could actually, be calling attention to some of those iniquities or some of the things that are at the root cause. And we have to be careful that we aren't just doing the individual thing to numb ourselves to that cause.
Yes, absolutely.
So I wonder if you can talk a little bit about some of the foundations of the idea of the ethic of self-care.
So, I mentioned Michel Foucault's work, but there's a few other kind of origins of the concept. One which I'm sure you both will be much more familiar with, but within the healthcare community. So in the mid-20th century, self-care developed as a way for patients who were elderly or required long-term care or lacked autonomy to treat themselves with exercise, healthy habits. And then later also a way for workers in high-risk or emotionally taxing jobs like therapists, social workers, first responders to combat job-induced stress and be able to do their jobs. And then there's also the political history of self-care, which I find the most interesting. Racism and sexism within the medical system has resulted in a lack of adequate care for women and BIPOC communities, and then intersectionally also specifically thinking about Black women. And then patterns of inequality along lines of race, class, gender, sexuality have shaped these broader health disparities as we talked about. So self-care can be seen as a way to reclaim the autonomy of your body. And these are things ideas that were coming out in the civil rights movement and the women's rights movement. Martin Luther King Jr. talked about injustice in health being one of the most shocking and inhumane forms of inequality in the United States. The Black Panthers organized the Black Community Survival Conference. And for instance, when the Young Lords were protesting in New York City, one of the things they did was they provided community health services. So they took a mobile, like a truck from the hospital and drove it around and gave vaccinations and, tuberculosis screening, things like this. So survival of individuals and communities who are neglected through these systems has been a part of self-care. And then also this idea that the personal is political, right? So transgender, intersex, gender nonconforming activists, feminists have long been politicizing the personal. And feminists of color like Audre Lorde, Bell Hooks, Gloria Anzaldúa have promoted self-care in different ways. So there's this very famous quote from Audre Lorde in her 1988 book of essays, A Burst of Light, where she says, "Caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare." Right? And Bell Hooks encouraged Black women to pursue self-actualization as a form of resistance to white supremacy and sexism. So the necessity of women of color to practice self-care and self-love in order to deal with a kind of daily onslaught of racism, sexism, homophobia, class oppression, right? So dealing with living in these systems and preserving yourself in a world that's hostile to your identity, to who you are. So this is the kind of historical, political roots of self-care as a concept. And we can see some of this, these ideas still today, right, in the way that activists are also promoting self-care.
I wonder if, so we've talked a little bit about the roots of the idea and about some of the implications on a broad scale. But in terms of resources and of what works and what people in this room and on Facebook right now or Instagram can do, I wonder if you can talk about some of that.
Well, I'd like to hear from people who are sitting here. So this is an individualized thing. What are some things that people here do to engage in self-care? Anybody?
I'll start.
Okay.
Because I want to talk about this because I have a series of things. So like get up in the morning and I write for 15 or 20 minutes, and then I'm going to read a book that has nothing to do with like my job. I'm going to read what I want to read, and then I might go for a walk. And as the days get shorter, it's like, oh my God, I've got to get all the self-care in before I go. and so it's almost like I'm getting trapped in this pattern of things that I have to do because I'm committed to doing self-care and I'm really good at commitment. So I have some things, but I'm not sure it was a good answer that I came up with.
Yes.
I would say, I'm someone that's an overthinker, perfectionist. I put a lot of pressure on myself, so I used to think my self-care was just keeping myself busy so that I won't be in my head so much. But now I'm just starting to calm down, appreciating the things that I do get done, the things that I have achieved, and doing things that like make me happy, even if it's not a lot. Because before I thought that a lot would be like, yeah, I'm doing things every time, so I don't have time for anything else. I don't have time to stress. But now it's okay. Like I'm not ignoring the stuff that I'm stressed about. I'm actually like dealing with it and talking more. Coming back to school was way better for me. Being in the city is like hard, especially with the pandemic going on. So being back at school and doing work and like really pursuing my career dream, like it's really good for me. So yeah, being here is something.
Thank you. Would anybody else like to share?
I'll share it. I'm kind of rebuilding my self-care. My self-care was hiking or going for a run, and since COVID, I can't do that anymore because of damage from COVID. So on my end, I am rebuilding what that is, and the good news of that too is COVID shined what's important in life and spending time with those. I think both Portia and Christy mentioned the one-on-one time with friends and family and calling those up, and that's become more of a priority than anything else. But rebuilding very much after 35 years of my life of doing the exact same thing to stress relief.
I think for me, a everybody, when I look at resources, I have to highlight the idea of self-compassion. You know, as you were speaking, I heard so much, maybe from you, that you were saying that you've learned how to be gentle with yourself, right? And to realize that we are all in this together. There's a common humanity to this. So self-compassion highlights the idea that sometimes we're harder on ourselves than we would be to other people in a similar situation, right? So self-compassion asks you to treat yourself like you would your best friend. So if this was my best friend, how would I be talking to her? What would I be saying to her? Would I be judging? Would I be criticizing? Would I be putting down? What would I be doing if this was my best friend, right? This is somebody I care about who's in this situation. So to me, self-care starts with that, having that regard for yourself, for being human. You know, and there's a lot of misconception about self-compassion. Sometimes people say, if I'm really kind to myself, then I'm going to slack off. I'm not going to do things. But really what we find in the research with criticism is that we think criticism works, but it has the opposite effect. Right? That criticism increases judgment and sensitivity and anxiety, but self-compassion tends to be a motivator. So when you're gentle with yourself, you tend to not actually slack off and not do things. You're more likely to be kinder, to move forward, to try again if you don't succeed. So I think it starts with that, listening to yourself, being kind, and letting your body, this is what's interesting in the research too, when you allow self-compassion in your life, you're gonna find that your body tells you what it needs. Right? Your body intuitively has been built right, to survive, so it will. Yeah, so I needed to hear that again. So that's, I think for me, that's my position on that. Just listening to your body, learning to really trust what your body will say. And this is also, we're seeing this in trauma work, right? A lot of our trauma focus over the last decade have been really that idea that we can integrate the body and the mind. And that the body, when it finds itself, it'll really direct you to what it needs. So sometimes you may wake up and actually not want to go for a walk. And that's actually fine. But maybe you want to read instead, right? And maybe you want to rest. So your body will tell you what it needs when you start to tune into yourself.
I think I want to go back to what Liz said a long time ago when we were talking about the definition of self-care. And one of the things we said was we really have to be really self-reflective. So when I really self-reflect, what's going to work for me as an individual? That said, my research coming here today, I did look up the evidence-based self-care practices. So I'm going to read the top 15, and I do have 25 of them for you. So if you want all 25, I'm happy to give them to you. But here they are.
We can email them.
I can email them to you. Okay, so here they are. Get outside. Even looking at pictures of nature have a calming effect on the brain. Get outside, be in nature. Even trying an outdoor workout. So Jake talked about this. He said, I used to run outside. It was very, 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 very calming for me. Even taking a walk outside, doing something outdoors. There's something about nature that is incredibly calming and healing for all of us. Pay it forward. I mentioned that earlier. Doing something nice. Pay somebody's coffee behind you. Just do something nice for another human being. This has a very wonderful, compassionate effect on our behavior. Remember to breathe, okay? There are apps on all of our phones. I don't have one of those anymore. I have the old-fashioned thing, but breathing is an incredibly powerful tool for helping us all regulate anxiety. And even more powerful, and I know Portia, because I know her well, she incorporates essential oil and essential oil therapy into her work, as do I. As there are specific essential oils that are very calming. Does anybody know what they are? Lavender. Lavender is one of them. And orange. The essential orange is very, very calming. So if you're into that and that works for you, and when you're doing your self-reflection, you're saying, yeah, I'd like to just put some lavender on my wrist today, and every now and then just smell that because it helps you calm down. That's great. Practice thinking differently. when you're under stress? Because here's what a lot of us do. We become stressed and think, oh, I just can't take this. It's too much. I'm overwhelmed. How can you think differently when you're under stress? Under stress. I've got this. It's going to be okay. I've dealt with things like this before. I'm going to do it again. All I have to do is take one step at a time. Okay. Thinking differently has a direct connection to how we feel and how we're going to act. Okay, so practice thinking differently.
And actually, Christy, that's a great point.
Yeah.
I want to remind everybody that our brains are built with a negativity bias.
Yes.
That's a survival instinct. So our brains tend to lean towards catastrophe.
Yes.
So it is a skill to actually move it the other way, to say, I will be okay, I can do hard things. Done it before. So really it is an exercise of really self-care to like challenge your mind to move away from the negativity bias, right?
Yes.
Yeah.
Practice gratitude. What are 3 things right now that I'm grateful for? I'm grateful that I walked here today and I made it on time. I'm grateful to be here with these amazing people and all of you, okay? And I'm grateful that we're in a room together because it wasn't that long ago that we couldn't even be together. I'm grateful. The more we practice gratitude, research tells us the more that we focus on positivity, that works against negative bias in our brain. And the more happy, there's actually research that we are happier people when we focus on gratitude. Isn't that amazing? That's amazing. Meditate. If you are a person who can meditate, I have a lot of clients who tell me, Christy, seriously, I cannot meditate, that does not work for me, I have tried. Okay, and I'm like, okay, that's fine, it doesn't work for you, but some people, meditation works, and that's fine. Dance. Anybody ever watch children? Have you watched little kids? Do you know how fun they are? Like, they dance, they laugh, they joke. You know they laugh like 500 times a day or something crazy? I mean, it's sort of really fun, right? Okay, when was the last time you really laughed? Adults laugh like 5 times a day or so. I mean, it's really sad, right? So just laugh and dance. Right?
And you know, another funny tidbit is that your brain doesn't tell the difference between a half smile that's not really for anything other than there to be there and a real one. So you could just go around smiling all day and your brain will think you're happy and it will give you extra serotonin.
There you go.
Half smile.
Half smile. Listen to music. Eat more fruits and vegetables. Swear. Just swear. Sometimes you just need to swear. Try some, now, and this is on the list, although I'm going to come back to a lot of things that Liz has said. These are very individual. Some of these are very individual focused. These are not related to systems change. And really we should put on this list, work on system change and be a advocate for social change. Try retail therapy. Have sex is on here. Okay.
Free and often.
Free and often. And read. Okay, so those are based in research for what it's worth. And if you want the rest of the list, I'm happy to share.
There are a couple of things on Facebook. Sarah Buck-Morrell says self-care can be accomplished in many ways. It all depends on the person and what they need to regain balance in their life.
Very good.
And she said she loves the quote that was mentioned, self-care is a way to reclaim the autonomy of your body.
I love that.
Yes.
I love that.
Yes.
Cecilia Gregoire says, letting your body do what it needs, sometimes allowing yourself to cry is
Yes. Yes.
I see that we are approaching the 12:50 mark. So I wanted to do a couple of things in case people needed to leave. One is call your attention to our list. We have a whole series of events looking at self-care, looking at, actually, next week, we're going to start with looking at freedom of speech. And freedom of speech, we know the Supreme Court has reaffirmed it. It's here to stay. We can question the limitations if there should be some, but knowing that it's here to stay and knowing that free speech causes pain, what are our ethical obligations as individuals and as a society? So that's actually next week. And then the following week, on that Friday, there are going to be a whole bunch from the Friday and all the way through that next week. A whole bunch of little offerings on self-care, on free speech, some chances to try some things, art, music. We don't have dance. I wish we had dance. But we do have a number of things going on. So stay alert. Look for those opportunities. We'll push them out at you.